pretty significant expectations about how they're supposed to perform academically, and carrying over some of that stress from gaps in learning that they may have experienced last year. They're also carrying around stress from the context that they're experiencing within their own family situation. So what is going to happen with respect to anything from housing situations to parental employment situations? Those are issues that remain real right now. And the stress that parents have, that gets translated into stress that students have. And then the final piece too is really understanding stress associated with how to navigate one another socially at this time. What are the new norms? What is supposed to be expected of me? And how am I supposed to be interacting with my peers at this point? Those are all going to be the stressors, and as they continue to hear more and more in the news and pretty much everywhere that they go, social media or otherwise, about what's happening in COVID, what's happening throughout the country, that's going to continue to create a lack of consistency in what they can expect. And it's that lack of consistency, and I know Dr. Berkowitz will speak to this as well, that's really going to be sort of at the core of the challenge for our youth in the coming weeks and months.
It's just not enough, and we know that.
Dr. Berkowitz, over to you on that.
And we know our Chris Bianchi is going to help moderate this.
So one thing I think is really, and Heidi alluded to it, it's not just COVID. And I think that's important to remember, that COVID is certainly front and center for all the various reasons. But kids are facing far more than, a pandemic. Some of it's the secondary consequences, as was mentioned, about, familial stability, income. But, in addition, we have in our face very much around here, the issues around climate change that are really, front and center in many ways, as we spent a couple weeks of smoky, hazy, poor air quality. So, there's that issue. There is the issue that, is, the lack of certainty but one school mandates masking, your other child may not have a school that mandates masking. There's people who think that that's a bad idea, and that comes out again in these relationships that the kids have among one another. So there's so many things to navigate for a kid going to school right now. Social distance, just add, and, it's enormous. And, I think, in many ways we're kind of living in the middle of it. And so it's hard to sometimes step back and recognize how much kids have to face and struggle with right now. And that, it's the parents, it's the teachers, it's the ministers, it's, everybody's struggling. And that's really hard for kids, right?
No doubt about that. And I think we're going to get into the component of it, not just necessarily being a COVID thing here in just a second, but want to remind for those of you who are just joining us that you can send in those questions right below. Just send it below with the Q&A button at the bottom of your screen. So remember, you can send in those questions for our panel, Dr. Stephen Berkowitz and Heidi Bassfield. And Heidi, I'm going to go over to you here for a question as well. Again, kind of broadening things out. I know we've focused a little bit on COVID, and that's for, I suppose, rather obvious reasons, but maybe getting a little bit more specifically about teachers. What role should teachers specifically play to include more mindfulness, perhaps, with our students?
Yeah, it's a great question. So teachers need to be provided support themselves on what is their role in supporting youth mental health. And where that starts is providing teachers with tools on how do you spot mental health issues. And there are plenty of trainings out there, some of them provided by Partners for Children's Mental Health and others with groups like Mental Health Colorado. So there's no shortage of support out there for teachers to be able to access tools on how to spot these symptoms, and then be able to provide appropriate handoffs to the appropriate kinds of professionals to support the needs that are coming through. And so we need to make sure that we're consistent in reaching out to teachers asking what they're seeing, asking what they need, and then giving them access to those kinds of tools. The practice of mindfulness is important because what it does is it gives space for people to acknowledge what's going on with them and to really be able to sort of take the time to have conversations about their mental well-being. And so for teachers to be able to create that safe space for that kind of conversation is an effective way to generate ongoing identification for mental health issues and to reassure kids that it's okay to have emotions that you need to talk about and to take time to think about how you feel, process those feelings, and get help from you.
Dr. Berkowitz, your thoughts on the role that teachers can play?
So I'm going to back up a little bit. I think, and Heidi mentioned this, but teachers are being asked to do more than ever, and they too are facing an inordinate amount of stress, and many of them have kids in school, right? So I think one of the most important things we're going to be able to do to support teachers to help the kids is they need their own support and help. And if we don't do that, then we are going to flail. So we actually do have a program that will be up and running, funded by the state, that it will provide a series of supports and group, support programs for educators throughout Colorado. So that should be up and running sometime in the fall. And I think that's crucial. I also think that, we talk about teachers, but I really think it's the educational system that really needs to learn from what has happened. What COVID did more than anything else in many systems was expose the fault lines that already existed. And one of the major fault lines, I think, that we're seeing in our educational system is the lack of emphasis on social emotional learning, on really changing our paradigms from rote education to thinking about what is the interplay of social relationships, mental health, other such issues in learning. And I think teachers are in a great spot to do that. And I think it's important to, mindfulness is one aspect, an important aspect, but change the paradigm to allow this to be more fluid, more natural in the school setting.
Interesting thoughts from the both of you. And I think we're going to delve a bit more deeply into the COVID topic. Just as a reminder, you can send in those questions using the Q&A button down below. If you do have a question for either Dr. Stephen Berkowitz, child psychiatrist and a professor at the CU School of Medicine, or Heidi Baskfield, the interim executive director at Partners for Children's Mental Health and the VP of Population Health and Advocacy at Children's Hospital of Colorado. So Heidi, back over to you. As I mentioned, I think it's important to get into COVID, and a lot of the questions we're receiving are COVID related. I guess first and foremost, I know you've already touched on this a little bit, but maybe kind of leading into some further conversations. What are your thoughts on the mental health impact of quarantine on students? And again, I know it's something you both touched on, but maybe specifically what we've seen in terms of maybe some recent studies or anything a bit more specific on that.
Sure. Well, what I can say, not just about quarantine, but sort of what we've been experiencing through the pandemic, is it's hard to be isolated from your peers at any time. So quarantine or otherwise, it creates a strain on relationships. And so what we're trying to continue to do is to acknowledge that we want to create a safe environment for kids to be with one another in person, learning together as possible. And so there are times, however, where safety requires that we separate for a temporary period of time so that we can come back together and be back together safely for in-person learning. And so what I would say is to continue to try to create safe environments for in-person learning is the best thing that we can do at this point. And of course, being isolated from one another is going to take a toll.
Dr. Berkowitz, over to you.
Yeah, absolutely think that's right. I think one of the dilemmas is, again, how long is it going to be until we're quarantined? How much I invest in my peers in the school when the chances are really high that next week we're going to quarantine. How do we navigate going back and forth? Every time you send kids home, you're starting school over again, right? And they're reentering maybe now with other worries and other concerns. I think, it goes back to, we really need a structure and a model that's consistent for kids and families. And that model, maybe we don't know, we're uncertain, but let's be uncertain together and talk it through. Yeah, we're going to probably quarantine. What's that going to look like? How are kids going to re-enter after quarantine? Those need to be mapped out as best as possible. I think that provides some support and ability to manage all this uncertainty.
Thank you, Dr. Berkowitz and Heidi, for those detailed replies. Staying on the COVID topic, as mentioned, we've received quite a few questions already from a lot of you out there. By the way, just as a reminder, you can send in those questions using the Q&A button below. Just send those in and we'll try and get to as many of those as possible. But another one that I think is a really good question, very specific to COVID, obviously here. What do you think, what do you tell your kids about vaccines when they might not be eligible for vaccinations yet? How do you navigate that? Heidi, I'll start with you again.
Sure. Well, I think what we tell kids is that the ability to access the vaccine for kids under the age of 12 is coming soon. And in the meantime, there are very practical ways to stay safe. So wear your mask in indoor settings, appropriately social distance, wash your hands. These have all been proven time and time again as effective practices to keep kids safe who at this time can't be vaccinated. And so that vaccine is on the horizon. And in the meantime, there are effective practices that can be used that create consistent approaches to building assurances for our youth.
Dr. Berkowitz, over to you.
Yeah, I think that's spot on. I think it's important also to be able to say, our primary goal is to keep you safe. And one of the reasons that you can't be vaccinated yet is you want to make sure that those vaccines are safe for you, right? And other ways of being safe is, as Heidi mentioned, masking indoors, social distancing, washing hands. It's consistent with why you're not vaccinated yet, because safety is paramount, and that's what we're focusing on as a school, as parents, is ensuring that you're safe.
Got it. And thanks again for both those wonderful answers. Moving on, and staying within the realm of COVID, and would it be better for a kid's mental health if there were universal mandates for masking? Do you think, Heidi, that it would be better to have maybe a bit more structure to it if there were just, again, those universal mandates, rather than we've seen some of the school board debates and some of the contention surrounding it? What do you think would be better for a kid's mental health?
I think it's a great question. So I'm going to answer it in a couple of different ways. One, you're going to keep Dr. Berkowitz and I keep coming back to consistency. And so the value of setting out a framework for which we're going to act and be around one another in a school setting, and being clear on what those expectations are and being consistent about those communications are really important. What I can tell you is that we know kids do better when they get to learn together in person. And right now, in order to be able to do as an effective a job as possible at creating the kinds of environments that support that, that masks go a really long way in supporting that objective. And so the more that we can say we're here to create a safe environment so that you can be here with your peers and learn, and wearing a mask is a very effective way to do that, then the better off we're going to be. Now it's really up to local public health leaders and our governor to make decisions on whether or not we have universal mask mandates. But the value of consistency and how we're creating very clear expectations for how kids can interact in a safe way is of paramount importance here.
So Heidi saying consistency is key. Dr. Berkowitz, I would imagine that you're going to stay consistent on your answer as well.
I'm going to be consistent with consistency. Yes. So I think it's incredibly unfair to parents and kids to have to make a decision about whether their child should be wearing a mask. You go to one school and you could be the only two kids who are wearing a mask and you stand out like a sore thumb. Another school, it's the inverse. And I think most people want clarity. They want leadership to make a decision. That's why we have it. And so I think it's an enormously bad idea to make it random and to force people to make these decisions on their own. So I'm all for mandates personally, but I want it to be clear and consistent for everyone.
Well, appreciate both of your answers. And by the way, if you're just joining us here on this panel between 9 News and the Denver Gazette, I'm Chris Bianchi with 9 News. We're joined this evening by Heidi Bassfield, Executive Director at Partners for Children's Mental Health, and Dr. Stephen Berkowitz, child psychiatrist and professor at the CU School of Medicine. You can send in those questions below, and we'll try and get as many of those as possible. So again, I know a lot of the questions we're getting so far are COVID related for, again, obvious reasons, but Heidi, another one for you that does pertain to that. Test scores, they really dropped. I mean, I know in varying levels, but we did notice generally across the board, those test scores dropped during COVID. How does mental health impact student achievement?
In a significant way. So the ability to feel engaged and to be able to be involved in your academic experience is very much informed by your mental health. And so to the extent that you're struggling with anxiety and depression and suicidal ideation, you're not going to be able to concentrate, whether it's on a Zoom screen or in person, on your algebra lesson. And so the greater that we see kids struggling with mental health, we'll continue to see impacts on their academic performance. And in some cases, this only exacerbates those mental health challenges. And I'll let the experts speak more on the details there.
All right, Dr. Berkowitz, I assume that means you.
I guess I'm the expert. So I think it's also important to recognize there are multiple reasons why kids had a hard time. In addition to the mental health. So I don't know about you, but finding a space when 4 people in the family are on video is really hard. And the more people on video, the less well it works. And then there's the issue of, do you actually have access to reasonable broadband and whatnot? So, and that creates a lot of anxiety, right? And a lot of worry. So, it's not any one thing that's going on for kids. And certainly those kids who are struggling, particularly ones who already were struggling with mental health issues, have a much harder time. And then, when you're not feeling like you're achieving, when you're not feeling like you have friends, that actually increases anxiety and despair. So it's a tautology, it's circular, and it builds on one another. And, we need to do our best to break those cycles. And I think, we again, together, I think we can do that.
Thanks to both of you for your answers there. One question that really kind of struck a chord with me, which I hadn't honestly thought of before I saw this question, but Heidi, should kids be screened for mental health issues as they come back to schools? And I guess another question I would tack on there, have you heard of any instances of that happening?
Well, I'm going to answer the question this way. In the same way that you go to your primary care provider every year for a well child visit, that visit should include a mental health screening. In the same way that we expect to check in on whether we're meeting those important developmental milestones, how we're doing with our mental health should be just as important and a core part of that interaction. So do I think kids should have regular access to screenings and support for mental health? 100%. And when Dr. Berkowitz talks about shifting paradigms, quite honestly, that is another huge opportunity for us to think differently in the way that we provide healthcare. You shouldn't have to go to different places to get different elements of your healthcare addressed. We should continue to build a system that meets both of those needs. And so in the same way that you're going back and making sure you're growing and doing all the things to be active and healthy physically, you need to support that mentally as well. So absolutely, that should be happening.
Dr. Berkowitz?
Yes. The one way I might want to tie it all together is when we're talking about mental health and mental health concerns, and when we're talking about education, we're talking about the brain, right? And I think we have to remember that the brain is just the most important organ in the body, and why we treat it as distinct or separate is, I think, a real problem. And so I think universal screening, whether it's in your pediatric office or at school or school, clinics, is absolutely as necessary as trying to find out if there are any other medical issues for your child. So absolutely, and you all know that there is an attempt, and Heidi and I have been involved in it, to screen kids across the state, and how best to do that is really an issue. There's the money, but we may not have the people. So how do we build a system that does that smoothly and rather than as an add-on? And I think that's again, that's one of the things that's COVID exposed that we need to address.
Speaking of COVID, I think we're going to move away for the moment from COVID because we've got a few other questions that I think are extremely relevant. One, it's something I think about all the time, just invoking myself a little bit here, but somebody who, I'm 33, so I was at the very end of high school when social media became a thing. And something I personally think about all the time is how children now deal with it. And more specifically in this instance, what's your advice, Heidi, to children and social media in maintaining their mental health? Do you set limits? What is your advice?
The healthy limits are everything. So to have the expectation that you can cut kids off of screens altogether in this day and age is not a realistic expectation. And sometimes it's been a helpful tool to be able to allow peers to have interactions when they can't otherwise see one another. So that it's not all downside, but having very clear expectations and limits on screen time are important. And there still needs to be just as much focus within that family context, within our schools, teaching kids how they interact in person with one another, and that it's not all done over a social media interaction.
Dr. Berkowitz?
So yes, and the research is pretty clear that about 2 hours of screen time a day is optimal, and anything over that can interfere with growth and development and emotional growth in kids. So limiting it is very important. I want to add something else that I am really been struggling with as a clinician and researcher is how social media really makes kids feel more lonely. And there are a number of reasons for that. And we have to address that. We have to figure out how social media can be a positive social interaction when it's often not. It's, some of the comments that you can get are unbelievable. Something you would never probably get in person. And also, I think one of the things that we're learning is that a lot of times we think kids are interacting with someone, and it's really just passive. It's YouTube, TikTok, so on and so forth. And that's not interaction, right? That's, it's the same as passive TV watching, essentially. So if you're doing that 5 and 6 hours a day, or playing a video game, and those are your friends who you're playing the video game with, who you've never met, and you've only had, interaction about the game, that's a real issue. And so we really need to learn more and understand more about the best use of social media.
Good insight from both of you. Certainly appreciate that. And remember, if you do have a question, remember you can send it below to our panel, Dr. Stephen Berkowitz and Heidi Bassfield, joining us here for this 9News and Denver Gazette joint panel on children and mental health. And I want to go over to, is there, maybe on the more optimistic side here, Heidi, is there less stigma surrounding mental health in recent years? And one thing that may have come to mind recently from the Olympics was the Simone Biles incident. What are your thoughts on that subject?
I actually think among youth, there is less stigma. I do think we're seeing, that is a positive development. I think if you were to ask kids and youth, they would say the stigma lives with their parents, and that it's us that has more of a challenge than they do, and acknowledging that there are mental health challenges, that they need help, and that they want to talk about it. And so I do think that's an upside. I do think not just Simone Biles, but a lot of different national figures that are speaking to their challenges with mental health continues to create that very wide open acknowledgement that most people at some time in their life are going to experience a mental health challenge. It is as much of the human experience as some of the physical challenges that we face in our lifetime. And so the more that we're bringing a common voice to that experience, saying this is normal, to not feel normal, the more we're going to see positive changes in that way. But I would definitely agree that I don't think that stigma is as big of an issue with our child and adolescent population as it is for adults.
Do you see it the same way, Dr. Berkowitz?
I think that's generally true. However, I think there are various cultures and groups, depending on a number of factors, where there is still a great deal of stigma. And so while I think the general trend in youth is to be more aware and less stigmatized, I think it does vary from community to community. So we have to do a good job and focus on those communities where there is more stigma. I also think, importantly, one of the problems, that occurs is we wait too late. And so we're often chasing our tails in trying to catch up with the needs. And, this again is where schools and parents are really important, is, how do we help kids be more resilient and better manage the stresses as best as possible? Now, if it's, 80 below outside, you're going to freeze, right? So the environment does really matter. But I think building, up the capacity to cope and manage, social connectedness, a sense of efficacy are really crucial, so that, we're not just, chasing after all these, severe situations.
Speaking perhaps of that, does Colorado, I know this is going to be a broad question here, so feel free to take this in however direction you want, Heidi, but does Colorado, in your opinion, have enough resources for kids who need mental health care? And does the state of Colorado have enough caregivers overall?
Yeah, it's a great question. I would like to be a whole lot more positive in my response than I'm afraid that I get to be. I think Colorado still has a pretty huge gap, and we don't have a comprehensive system of mental health care for kids in this state. We just don't. And that is informing so many of the challenges that we're seeing right now, is that we don't have care that appropriately exists in the number that we need it to exist at almost every level. And so there are different reasons for that, but there needs to be a very different commitment on behalf of the state of Colorado in partnership with our friends at the federal level to change that as quickly as we possibly can. We need more providers. We need an actual system from soup to nuts that's going to support need. And I will tell you, it doesn't exist here.
Dr. Berkowitz, is it the same in your view?
Well, so just a little bit of background. I came to Colorado 3 years ago. I was in Connecticut for 20 years and Philadelphia for 10. And the gaps in mental health care for kids in Colorado are just much greater than anything I ever experienced, in either of those states. I also think it's really important to recognize that while Colorado may be worse than a lot of places, no place has sufficient number of providers. It's just not possible. And that's why I said before that I think we have to focus, really early on in trying to help kids be more resilient, more able to deal with this, regular stresses and strains more effectively. So it needs a real continuum from prevention to early intervention to crisis response to treatment across the board. And it really does require a restructuring of our system, and it does cost money. That's just reality. And we have to figure out how, do we value this? And are we concerned about youth suicide and mental health issues? And if we are, let's take the resources that it takes to do it right.
Dr. Stephen
Chris,
Berkowitz. Oh, yes, go ahead.
If I can jump into and even say, I think it's important to note that this governor does care and acknowledge that we have these gaps, and I will say has spent increasing time and investments in beginning to see that change come through. So in creating a new behavioral health administration, pushing new money dedicated into mental health specifically, are all important steps to begin to course correct for a problem this administration, quite frankly, inherited. So this has been that dirty little secret that governor after governor hands off to the next one and doesn't get effectively addressed. And I will publicly acknowledge that this governor is recognizing that problem and is beginning to take steps to address it.
Well, that's reasonably encouraging at the very least. There to hear your thoughts on Governor Polis and what he's done. By the way, just as a reset for everybody who might just be joining us for this 9 News and Denver Gazette panel, we're joined by Dr. Stephen Berkowitz from the CU School of Medicine, and Heidi Baspiel, who you just heard from a second ago, from the Partners for Children's Mental Health and Population Health and Advocacy at Children's Hospital of Colorado. Heidi, and again, maybe with those lack of resources in mind, maybe arming or equipping parents with a bit more information might be helpful here. So maybe one question that could come to mind is, how can a parent or a caregiver tell when a child's mental health is out, perhaps not in place, and what are some initial or even deeper signs to look for?
Yep. I'm actually going to punt to Dr. Berkowitz. I think he's the better one to answer that question.
Well, first, I want to say, it's a lot to ask parents to become, psychologists and social workers. So one thing I tell parents in general, if you have any concerns or doubt, ask. Find somebody to talk to about it, whether it's a, school counselor, psychologist, pediatrician, ask. Don't think you're the one who's going to evaluate your child and figure out what's going on. And what is remarkable is parents do know. They may not know the details, they may not know the exact symptoms, but they know when their child's off. They know when they're struggling. And I think we need to empower parents to give them the credit that they do know, and they don't have to get the list of signs and symptoms, and and to feel confident enough to say, I'm concerned. I need to ask somebody with more expertise than me, rather than, going on the web and, reading the list. We can give the list, but they know, they really do. And a number of times I've had a parent say to me, I was concerned 2 years ago. I didn't say anything. I didn't, thought maybe I was being hysterical. No, when in doubt, take care of your kid. It's no different than saying, hey, that fever's a little higher than it should be. I better, find out what's going on. And that's my answer. Don't look for signs and symptoms. It's your gut.
So listen to your gut. Well, usually a good sign in many ways, but perhaps especially so in this one. Now, maybe flipping things over, and Dr. Berkowitz, I'll probably stay with you on this one. What are things that kids can do? So maybe, again, turning the tables a little bit, what can kids do to take care of their own mental health?
Okay. Well, the first thing is nobody takes care of their own mental health. We don't do this in isolation. Mm-hmm. So one of the most important things you can do as an adult child at any age is to be willing to express what's going on with your peers, friends, parents, whatever. That's where we know that being connected and interacting around, profound and difficult situations actually helps people's mental health. And so, this is why that issue of isolation is so important. That you don't do this on your own. The notion of self-care is a term I think we should throw out the window. You can do things for yourself, but care is really about being in the community and sharing concerns. So I think, if I was was a superintendent, I would have regular social emotional groups for kids just to talk about what's going on for themselves, and what they're struggling with. That's going to be probably the best way to take care of one's mental health. I'll just make it personal. The work I do is really, really stressful and hard. And if I didn't have good colleagues and friends to talk to about it, I wouldn't be able to do the work. And I think that's, right now, that's certainly true for everyone.
And Heidi, any additional thoughts on your end?
A couple of things that I would just add. This next year, we're going to see a new resource come online for kids themselves. And it will be a web-based application where they can engage in a screening tool and go through that screening. It self-identifies what's going on and then offers them the opportunity to link up with a professional and receive 3 free visits to address the needs that were identified in that screening tool. And so what's great about this program is it is all about empowering youth to self-identify and engage in a process to support their mental health. Now, this program isn't going to be without bumps. It's not going to be perfect, but it's a really great start, and it's a really great acknowledgement that kids can and should begin to voice for themselves what's going on and have access to resources to address those. And so that would be the one thing that I would add, is that that's coming online as we go back into this stressful time in school.
Hopefully some good news there. I'll start by saying, by the way, joined by our panel here, Dr. Stephen Berkowitz and Heidi Basfield. Heidi, we'll go back to you because that's been the order we've been going for the majority of this time. I will admit that I don't know if this is exactly correct as stat, but I'm going to read the question for you, which is, why is suicide such a problem in Colorado? Isn't it the biggest cause of death for teens here? I'll ask you if you can, first of all, verify that, because I don't know that off the top of my head.
Yep, it's a great question. The answer, unfortunately, is for the kids age 10 and up, it is the leading cause of death in the state of Colorado. And I'm going to have to hunt to my colleague here, Dr. Berkowitz, to talk more about the awareness around what might be informing that. But it is absolutely the situation in the state at this time.
So it's also, just to put in perspective, the second leading cause of death for that age group in the country. So we're we're just a little bit ahead of that curve. There are lots of reasons. Again, isolation is one of the major causes. Access to lethal means is a real issue, and most completed suicides are using guns in Colorado, and that's also one of the reasons that we see more completed suicides in males than females. So it is a crisis. There's just no question about it. When I started my career, I won't say how long ago, suicide was the fourth leading cause in that age group. So over the last 30 years, it's gone to second and first in Colorado. We need more, as we were talking, it's very consistent with, we need more access, more communication, less stigmatization, and frankly, we need to lock up all our guns very securely. Those are some efforts that are going on. But it's pretty clear that the world is so complex and stressful for kids and parents and adults that the increase in substance use is parallel to suicidality, for instance. So there are definitely things we can do, but it's my old saw. We got to do this together, and it is about interaction and communication.
And just in follow-up to a little bit more on that point, Dr. Berkowitz had spoken earlier about the importance of building resilience, because kids are going to face hard things. And we need to be giving them the tools to know that they can work their way through those hard things. And especially in those adolescent years, really supporting kids to understand that they can see themselves through a moment. Because as Dr. Berkowitz, I'm sure will affirm, that's not what their brains are really good at that stage of the game. And so being able to say, we're going to walk through this, we're going to talk through this, and what feels like something that can't be dealt with right now is a moment, and we're going to see our way through to the other side, is very important when it comes to our adolescents and teens. The other thing that I'm going to point out from an alarming trend as well is that the age of children who are engaging in these activities continues to drop. And we're seeing kids as young as 7 who are winding up in the intensive care unit here at Children's Hospital after engaging in an attempted suicide. I'm a mom, and it's hard not to get emotional to talk about it. I have a 7-year-old, and I can't even fathom what goes on that would bring a 7-year-old to the brink to engage in such an activity. And that's why continuing to check in and create space to talk about problems and how we're going to work together to solve them is so important. It's not always an expected outcome. These aren't things that we can always predict. And what we continue to see is how we build resiliency, how we create safe spaces for conversations. And to Dr. Berkowitz's consistent point of ask for help. Anytime you're not sure, reach out and ask for help is, I think, the mantra that if you take away nothing from today, that would be the one thing, is if you're not sure, ask for help.
Yeah, and just to piggyback on that, I think, it's very hard to conceive of a young child wanting to kill themselves. I mean, it doesn't compute, right? So I think often what happens if an adult, even hears about it, because it doesn't compute, they don't get the kind of attention that may be necessary. And the idea that, okay, it's this is just a moment. Well, maybe, but I think again, take it seriously. No harm in taking these things seriously, and if you're wrong, so what, right? But if you're right, goes a long way.
Good advice. Again, very difficult subject, obviously. Got a few more questions. still coming on in here. And I suppose one question I've got that maybe especially during the age of COVID, maybe more and more relevant is, do you think that telehealth works? Do you recommend it? And Heidi, I'll start things off with you on that.
Yeah, I think especially in the place of mental health, it certainly does. And when I think about creating new access points, when you have a shrinking workforce, being able to utilize telehealth as a mechanism to still be able to provide access in mental health care is a really important thing at this point. And so you've got a whole generation that's got a very high comfort level in having interactions in a tele-based format. And so to give them access to the kinds of mental health supports they need in a format that they're used to and comfortable with continues to make a lot of sense. We're not seeing kids use it less. We're not seeing satisfaction scores from those engagements low. We're actually seeing quite the opposite. We're seeing people actually quite pleased with having those offerings afforded to them on their screens.
Dr. Berkowitz, do you have the same feelings about telehealth?
I have a little more nuanced. We don't know who best utilizes telehealth yet. That's a whole area of research that needs to be done. So most people seem to really like it and it seems to work well. But there are those where it's not working so well, and we need to understand who they are and what is it in specific that makes that more complicated. I'll also say that, depending on the child and their age, their ability to focus and attend, telehealth may not be the best approach. And certainly, when we were quarantining and we were doing, that's all we were doing. Often we ended up having to spend much more time just, working with parents rather than treating the younger kids. So I think in general, it's a very effective, but we need to understand more about who it's most effective for and who it's not effective for.
I've got a couple more questions here for our panel. One, Heidi, is how much of a role does teen substance abuse play in mental health issues?
Yeah, I'm going to hand that over to Dr. Berkowitz as well.
Most substance abuse use by kids that is serious and chronic is due to having a mental health issue. Unfortunately, the number one leading cause of substance dependence is a history of trauma or a maltreatment. It really is an attempt to self-medicate, and then what happens is it takes on a life of its own. We need to be able to treat effectively the causes of the substance use as well as the effects of the substance use. And it's a real conundrum. The other thing is we have a lot of parents who are substance dependent. And that definitely increases the risk of substance dependence for the kids. And so I think we need to think about the family as a unit of intervention in most cases when we're thinking about substance use and the related mental health issues. Hopefully we'll do that and get out in front of this. But it's a real scourge right now. And again, access is just inordinately easy.
And if I can piggyback just on that too, when we continue to talk about going back to school and how we support our kids and those kinds of things, I'll tell you that in just as many conversations that we're having, parents are having their own struggles that they also need to meet. And so whether it's substance abuse or otherwise, if parents want their kids to have their mental health supported, they also need to have their needs addressed, and they need to reach out and get support for those needs. And it has a direct implication on the mental health of the household. And so to the extent that parents are feeling stress, anxiety, depression, their own feelings of suicidal ideation, because those are real. Those are things that parents need to address. They do impact the youth in their lives, and there are resources out there that parents can tap into to get that kind of support.
Yeah, my turn to piggyback on your piggyback. One very important thing is, often parents think kids don't know, right? They've hidden it well. They're, the financial, their emotional issues, the substance use. Kids always know. They always know. Maybe not, in the most definitive way, but they feel it. They really do feel it. And I think that's, really important when you're talking about what's going on in the family and what the kids' reactions are. They know. They're struggling with it too.
Well, it's certainly been really insightful, and we appreciate all the questions that we've gotten in. I think we've got to pretty much all of them, but it is time for closing statements as we get things wrapped up. Heidi, we'll go for you. Any closing thoughts, anything you want to piggyback off the piggyback?
Thanks. I want to thank 9 News and Denver Gazette for creating the space to have this event and for allowing me to join. So thanks for that. What I would just say in closing is it's going to be another tough year. And we've got a lot of different difficult circumstances that will continue to persist for the weeks and months ahead of us. And as difficult as things seem and may get, there are ways to reach out, to get help, to get support, to not feel alone, and to get support for yourself if you're a parent or a teacher, or if you're a youth and or trying to look out for your youth. The resources are out there. They can be provided. Get the help that you need, and no concern is too small.
Dr. Berkowitz, your closing thoughts?
Well, first, Heidi gets to go first, and so therefore she gets to be more gracious. But I really am a firm believer that media has an important role, and I really appreciate the efforts. This is the way we get the word out, and we have to continually do this. These questions are going to rise and crop up, and I don't know how many participants we had, but we need to keep doing these sorts of things. And it is going to be a hard year, and we have to we have to acknowledge that. We have to accept that. One of my pat lines in my talks to people is, "No one's okay," and it's okay because we're all in the same boat. It's a matter of degree. I know I've said this, a couple times. The way we're going to get through this is if we do it together. And we really need to facilitate community and conversation. And we have to ask adults to put themselves in the skins of the children. We have to have them remember what it was like to be 9, to be 8, to be an adolescent. They have to be able to do that. And to be able to, use that as a way of coming together in the best interests of their child.
Well, Dr. Stephen Berkowitz from CU School of Medicine, Heidi Bassfield from Partners for Children's Mental Health, and from Children's Hospital of Colorado. We really appreciate a few minutes of your time, and hopefully for all of you watching and joining us this evening, we've been able to equip you with some of those tools to help you navigate through what Dr. Berkowitz called basically, it's going to be a difficult year. So hopefully, at least there's some of those tools and at least some of that background knowledge to get you through there. Vince, I'll hand things over to you if there's anything else you'd like to get into before we sign things off.
Chris, thanks so much for moderating, and thanks for the great conversation and for the specific granular advice for everybody. I really appreciate that, Dr. Berkowitz and Heidi. I feel healthier already, which is great. Great to feel that way after a conversation like that. I just wanted to say, speaking of getting the word out, this video will be available on 9 News and its social media channels, and on the denvergazette.com and its social media channels. So we'll we'll write more about this subject and talk more about it. And I appreciate the great conversation here and the helpful tools. Thank you all. And Chris, thanks for moderating.
Thanks, everyone.
Good night.
Recording stopped.